New worries tonight that the war in Ukraine could create another wave of COVID-19. Here to answer your questions about that and a lot more, hopefully, Dr. Ali Raja, the Executive Vice Chair for Emergency Medicine at Mass General Hospital. Great to see you, Doctor.
Thanks, Maria.
Yeah, hi there. Cases are down in the region. We know that. So why does the WHO say it's concerned about a surge?
It's a great question, Jessica. Here's the thing. You're right. Cases are down, just like many other parts of the world. The problem is that Ukraine's vaccination rate is really low. It's only about 34%. You combine that with the fact that they've got all these attacks happening on their hospitals, their clinics where patients might go for testing or care for COVID, and you've got the makings of a significant surge.
Doctor, there's obviously, we keep seeing these images. There's so much suffering in Ukraine right now. You're seeing the same horrific images every day that we are. So if you're triaging that population, are you even concerned about COVID?
Maria, you are. I've worked in disaster settings over the years, and each one's a little different. Obviously, you're right. Threats to life and limb have to come first. But in this case, medical responders they're juggling the effects of the war as well as the effects of COVID. So the Romanians, the Hungarians, and others, they've set up teams to test and vaccinate Ukrainians who are escaping the war. So they're trying to help both in the short term as they flee, and then longer term to keep them protected against COVID.
Right. I know there are humanitarian groups already in the region providing medical care, even in the war zone. We spoke with one doctor we know who's in all of that. What can you tell us about the doctors who volunteer to do this work?
They're amazing. All of the medical team members are the doctors, the nurses, the respiratory techs, the administrative folks that manage the logistics of supplying the medical teams. They're all giving up their own time to go over and volunteer and take care of the Ukrainians in need. But I do want to emphasize one thing, and I always tell this to all the doctors that I know. It's really important to go over as part of a team from an established organization. I've seen time and time again where individuals try to go over and help, but they either don't have the training or the supplies to have the impact that they'd have if they were part of an established team.
No, that's a good reminder for sure, because we have a lot of people who are writing into us and sharing their thoughts with us. We want to go over and help. I have a friend who says, I need to go over and help, but that's a really good reminder. And viewers are also saying, what's the best medical organization that they can support? In your opinion, what is it, Doctor?
You know, there's a lot of organizations doing great work in Ukraine right now. I think the key is that before you make a donation, you have to do some research to ensure that the organizations you're donating to are reputable. But four off the top of my mind, Doctors Without Borders and the Red Cross are doing amazing work. The International Medical Corps, Team Rubicon, those are four just off the top of my mind, but there's more out there. Do some research online, but those four are really solid.
All right, Dr. Raja, thank you so much for your time and for your insight as always.
Thanks, Doctor.
Thanks, Maria.